Thank you, Ferdy, and thank you all for being here, and the organizers for asking me to do this overview of this rapidly developing and quite exciting field. I acknowledge research grant funding from GE Healthcare and GlaxoSmithKline. There's really been amazing advances, really in the last year even, in hyperpolarized carbon-13 MR. So it's really exciting to be able to present that. This ISMRM, there have been about 180 abstracts. There are 5 focus sessions, including 2 study group and a plenary session, which you're at now. There are 5 sites in the world that have presented human hyperpolarized C13 pyruvate studies that acquired in the past year in prostate, liver, brain, breast cancer, and heart with a commercial DNP polarizer. Huge variety of preclinical studies with applications to cancer, heart disease, MS, traumatic brain injury, renal disease, diabetes, placenta, muscle, lung disease, treatment effects, and about 20 others, it seems. It's really expanding rapidly the usage of this technology. There's also expanding number of hyperpolarized C13 agents. For the majority and for the human studies, pyruvate has been the agent used, but urea, fumarate, arginine, and a large number of other ones have been used now in preclinical studies, with more moving into the clinical studies in the next few years, I believe. There are lots of new methods for polarization, a lot of advances in DNP and parahydrogen techniques. Also the acquisition techniques, new coil sequences, and in reconstruction and analysis. Big improvements in making quantitative kinetic rate measures, modeling, parallel imaging, perfusion, permeability, and diffusion. In this talk, I'm going to give an overview of the background and some of the current clinical and preclinical studies from about 15 different sites that sent me slides. So the history goes back really to 2006 when these papers came out, where Dr. Goldman's group in Malmo had developed a new hyperpolarized C13 contrast agent approach to image enzymatic conversions in key metabolic pathways in vivo for the first time. So this paper was really exciting. It showed the ability to inject one compound, pyruvate, but see its metabolic conversion in the same acquisition to alanine in muscle and very prominently to lactate in tumors. This was using technology that they developed there, and this is some of the first polarizer using dynamic nuclear polarization to increase the signal about 10,000-fold over thermal in a liquid solution that could then be injected. And this was first described in Jan-Henrik Ardenkerr-Larsen's et al. Paper from 2003. So basically it allows us to really do biochemical measurements of the conversion of pyruvate here in mitochondria and the normal tissues. It'll go into the TCA cycle, and we can detect carbon dioxide and bicarbonate. In muscle and liver, we see a lot of conversion through ALT, alanine transaminase, to alanine, or through LDH to lactate. And LDH activity is highly upregulated in cancers 5-fold. And by using the MR frequency differences, we can detect this information all simultaneously and look and quantitate the amount of lactate, alanine, pyruvate, and bicarbonate, and look at it with time. The instrumentation, these are some of the polarizers we have at UCSF. There's the commercial hypersenses for preclinical studies. This proof of concept polarizer, which was used for the first in men studies from a couple years ago that I'll talk about. That was in a clean room. and now the new spin lab systems, we have a prototype that's a 3.35, and then the product version, which is now at, I think 18 units are now sold in the field, and that's increasing over the next years. So this paper came out in 2013 describing our first-in-man safety and feasibility trial. It showed that we could, the feasibility of studying 31 prostate cancer patients and with pyruvate, and quite significantly, there were a couple interesting findings. One was in this one patient in which there was bilateral biopsy, but only on the imaging on just one side, on the right here, had picked up. It was observable in the images. However, based on upregulated LDH activity, we could see this higher conversion to lactate on both sides, and a subsequent MR-guided biopsy confirmed cancer in this location as well. This gave the impetus for creating new clinical trials of cancer really around the world. Right now, there's a total number of more than 860 funded patient studies that are planned in a wide variety of cancers, as you can see here. And as I'll show in a minute, there's also heart disease studies which are being proposed. So there's really probably about 1,000 clinical trial patient studies planned. So now for the prostate cancer patients that we've been doing now with the clinical polarizer, this is the setup here where the pyruvic acid is polarized and then put to a power injector, injected in the patient, and we detect signals with an endorectal coil with a clamshell transmit. And it really gave us incredible data. We're now using a new sequence developed by my colleagues Peter Larson and Xinyu Chen, where we can get three-dimensional data in just 2-second time resolution. And so we can get full gland coverage. Here is the pyruvate coming in and then being converted to lactate. In this patient, it was multifocal disease throughout the gland. And this is the group doing it: Xinyu Chen and Jeremy Gordon, Peter Larson, our great pharmacist, Marcus Ferroni, and the prostate studies are led by my colleague, John Kerhanowitz. And so this is really showing the variety of data. So we're with this twofold increase in polarization provided by this the spin lab instrument, we were able to now get unprecedented spatial and temporal resolution. The 3D data that I showed from the first trial was acquired in 15 seconds. So it's an average over a period of metabolism and T1 decay, whereas here we're able to do this every 2 seconds. And from this, we're able to be able to calculate now the rate constant. Instead of a ratio that really varies some with time, now that we can get a quantitative measure of rate constant, which is a much better way to quantitate this. And we're finding in preclinical models, as are others, that this is a much more robust and really the way to go. And it's quite exciting to be able to measure a biochemical parameter like a rate constant in a person, really for the first time in this way. Also, a recent patient was very exciting to me because we were able to pick up a cancer in the central gland, which is often very difficult to do. And looking on the T2, you can see that there's some signal abnormality here. The ADC image shows some reduction, but it's really hard to tell the extent of this because there's also stromal tissues. But we could identify the cancer here based on this upregulated LDH activity. Moving from the prostate, our next studies, led by my colleague Sarah Nelson, was in the brain, where we're using a carbon transmitter and an 8-channel array here, developed by Jim Trop, Paul Calderon, and Fraser Robb from GE, along with the engineers at UCSF and Dr. Il-Woo Park. And this has given us really exciting brain data here. In this patient, we can see very high SNR, and the pyruvate is definitely getting into the brain, crossing the blood-brain barrier, and we can see lactate. In this other patient here, we also see this. Now, these spectra are corrected for the reception profile of the 8-channel array. And for flip angle, because we use a variable flip angle scheme, you can see the pyruvate coming in first and then converting to lactate in the brain. And this is Il-Woo Park, Suzanne Chang, and Sarah Nelson are directing and leading these studies. And I'm just zooming in here just to show the beautiful data we're able to see now, the pyruvate coming in and converting to a lactate in the brain. And I think it's opening up the door for a lot of new brain studies, and I'll talk about some preclinical applications for that. At other sites, such as Sloan Kettering, they're also doing prostate cancer studies, seeing very similar results in this significant upregulation of LDH, usually up to 400, 500%. They're detecting this also by hyperpolarized carbon pyruvate. And here's an area under the curve image for a 2D acquisition in this prostate cancer patient. They're also doing it in the breast and other cancers. At Cambridge, where Ferdia, who just introduced me, his group is doing some great data too, and did the first liver cancer. This is a colon rectal metastasis to liver, where they can see also upregulated conversion to lactate in the region of the tumor. At Oxford, they did the first heart study here, in which they're getting exquisite spectra here. They're injecting the pyruvate, but being able to pick up alanine, lactate, bicarbonate, and even CO2. Chuck Cunningham's group in Toronto, they've used an acquisition here, which is a single-shot spiral that's cardiac gated. So very rapid acquisition to pick up the pyruvate and even bicarbonate and localize it in the human heart. So these acquisition developments are very important. In addition to the spectroscopy and the spiral, we've been working on an EPI acquisition. This is work by Jeremy Gordon and Peter Larson. It's a very rapid, we can get dynamic images, and we feel that this could be very advantageous for clinical translation with a reconstruction right on the scanner. Cornelius von Mortz had the great idea a few years ago to study urea transporters with this technology. So not looking directly at metabolism per se, but into transport in the kidney, and could look at the variations in different metabolic states in the kidney with looking at the urea transporters. And in collaboration with Eugene Milstein, he's taken this to do really high resolution, and Galen Reed also, really high resolution images of the kidney with urea, but also applying this, because of the long T2, to look at lactate and C1 and even C2 pyruvate. And we can get really high resolution images down to millimeter resolutions, or 1.5 millimeter isotropic, in just 4-second acquisition. And other sites are applying this in large animals here in Aarhus, Chris Lautson's group is looking at pigs here and in the kidney, looking at the assessment of the urea gradient in the porcine kidney. Angus Lau and Damien Tyler in Oxford have used it to look at cardiac metabolism and perfusion simultaneously by copolarizing pyruvate and urea. And then at this meeting, I was very impressed by data from the Zurich group, from Bastian Kozurka's group, showing the ability to look at velocity-sensitive acquisitions of hyperpolarized urea. Professor Lucio Friedman is applying this to look at muscle activation, breast cancer metastases, and perfusion in the placenta. In Munich, they're working on a lot of new sequence development and comparisons, and also new agents by looking at hyperpolarized bicarbonate here and N15 glutamine. In Zurich, what I was just mentioning with the urea, they're also looking, here they're looking at the cardiac perfusion and showing their setup here with a scanner and their other polarizer and high field system for preclinical studies. Dr. Murali Chirakura spoke earlier this week at our study group showing really exciting new data looking at response to therapy with substantial changes just 2 days after treatment in animal models. At the Penn, as was shown in prior talks, this group has done a lot with hyperpolarized gas studies, and now they're also doing hyperpolarized C13 to look at the metabolism and the biochemical changes in the lung using this technology. In Aarhus, as mentioned before, they're doing the urea studies. They're doing a lot of large animal studies and are moving towards a human for the study of heart, kidney disease, diabetes, and cancer. Oops. Also important is the development of new analysis methods, and the groups at University of Texas, at the MD Cancer Center, led by Jim Bankson, is developing new modeling and analysis methods are really key. Also, Sean Fain's group at the University of Wisconsin-Madison here are developing new methods for quantitation and providing multi-parametric functional maps and spectral imaging. What's been exciting to me is the breadth of neurologic applications coming out recently. It used to be thought that pyruvate, since it was charged, wouldn't cross the blood-brain barrier, but as a small molecule it actually does, and does pretty well, as we're finding in the humans. But it also is, can be used to characterize multiple sclerosis and traumatic brain injury. These are work by Miriam Shamil at UCSF, and the group at Maryland with Dirk Meyer and Stephen DeVince and Jin Liu had shown just beautiful data on the traumatic brain injury model. And they're also looking at liver disease, prostate cancer, and developing new sequences. The UT Southwestern group's been one of the pioneers in applying hyperpolarized carbon to small animal and perfused hearts. But now Craig Malloy sent me late last night or early this morning their most recent data in a pig model showing just really beautiful images now acquired on a clinical scanner with an 8-channel array of bicarbonate and pyruvate in the porcine heart. Now that they're PET-MR scanners, that opens the door to being able to look at both together. So in Copenhagen, they've been using this in looking at canine patients, so dogs that have cancer that are getting scanned, referred by veterinarians, and they're finding really interesting results. In many cases, the FDG and the lactate were fairly similar, providing good depictions of the cancers. But in some cases, the PET did not show, was not elevated in the whole tumor, whereas the LDA, the pyruvate to lactate conversion did reflect more of the complete size. And this work has also been done with the FDG PET study at Stanford and showing it in a glioma model. And again, they see some cases where they're concordant and some cases where it's discordant. So in summary, hyperpolarized carbon-13 MR is a rapidly advancing MR metabolic imaging method, providing new measures of enzymatic kinetics and key metabolic pathways in preclinical and now clinical research studies. New research is expanding the variety of applications, number of hyperpolarized compounds, and the biomedical information obtained by this powerful method. I thank the 15 research groups for providing all these great slides. I want to acknowledge my colleagues at UCSF in radiology, though external collaborators, pharmacy, oncology, GE Healthcare, Oxford Instruments, and the isotope vendors as well for making this possible. And I acknowledge all these people who were key to acquiring this data, the UCSF data, and give you our website for our center if you're interested to come and visit sometime. We look forward to you coming. And thank you for your attention.